Hello guys, this is Nicole Bigio again. Today I'm going to be doing my informative speech, and what I will be doing it on is my daily job. I work as a housekeeper in a hospital here in Leesburg, and what I usually do during the day is I clean the operating rooms, also known as the ORs. That's where they perform surgeries. And I wanted to teach you guys how to do a quick turnover, which is what they call a cleaning after a surgery or after a patient comes out of the surgery room. The first thing you do is you start out by taking trash out. You go through every trash can. There's usually 3 trash cans inside the room. There is the regular trash can, the biohazard trash can, which contains all bodily fluids. It can be dangerous. And you take out the dirty linens, which is the sheets and everything they've used, like towels. And we also have things called canisters. Those are containers where they have bodily fluids that the doctors have used to take out for like tests and all that. We have to solidify those. We use this thing called solidifier. It's a powder that can solidify up to 15 cc's of liquid, 1500 cc's of liquid. So we do that. We put that in a biohazard bag and we put it in our trash cans. And then we go on to wiping everything down. So we wipe our equipment down. A quick turnover is not the same as a terminal clean. Terminal clean is when you are completely finished with all surgeries during the day, and that's a little bit deeper. So what we're going to be talking about is just a quick turnover. We wipe everything down. I personally start by the bed. We also call it the operating table. We take all the equipment out of it. We take all their armrests. We take all of the mattresses. We turn it upside down. We make sure we wipe everything down. On the bottom of the bed there is metal, and usually there tends to be blood or iodine there. Iodine is what they use to clean the patients before surgery, and that stains, so we have to make sure we clean that up very nicely, make sure there's no blood anywhere. We wipe down our tables. We usually have 2 long tables in a room, which is where they put their equipment. The surgery techs, they'll put all their scissors and all their sharp equipments, and then usually there tends to be blood there too, on the tables or on the walls, so we have to make sure we get that too very well. And then we have 2 tall tables. They are used to kind of transport utensils around, and we have to wipe those down too. We have to wipe down armrests, which there's usually 2 of them in the rooms, depending on what they're doing. They also have the ortho beds, which are different, so we have to make sure we take every part of that equipment and wipe it down quickly and nicely. We also have the anesthesia circuits, and that's something interesting because I wouldn't think that a housekeeper does that, but we also wipe that down. We take all of the anesthesia circuits out, what they use for the oxygen. They usually have a mask and it's like a clear string, and that transports the oxygen to the mask for the patient. We put new canisters in, which, if you remember, that's what the containers are, the clear containers, where they can suction bodily fluids out of the patient. Also, if they have saliva in their mouth while they're sleeping or something, they can also take that, use that. So we put new ones in. That's after. So we just have to make sure we take that out first, and we clean everything. We use sanitizing wipes. They kill every bacteria and virus out there. So for housekeeping, we use very specific utensils and chemicals. And those wipes usually are sanitizing wipes, and they kill all the bacteria and viruses out there. And they're the most powerful thing we have to clean with. So after we wipe everything down, we go on to making the bed and putting new anesthesia circuits in. We usually get they call it the yanka, which is the utensil used to suction the bodily fluids out. It's like a big stick. We get the suction tube, we get the canister, we put that in there. And then we get the actual anesthesia circuit, which contains the mask, the new strings for the oxygen. We plug all that in, and that is part of my favorite. I think that's my favorite part of the job, is putting the anesthesia circuits on. It's kind of very technical. There's very specific steps to that you have to take, and I just like doing all that. I am actually thinking about going in for anesthesia, so that kind of helped. And then after that, we make the bed. We use, for a regular bed, we use 2 flat sheets. We use 1 flat sheet. We cover the whole bed. We use a draw sheet, and that's used for transferring the patient from the bed to the operating table. And then we use a pillowcase for the armrest, and that's it for the bed, depending on what kind of bed you're making, but that's just a regular bed. And then we go on to mopping the floor. So I personally like to get in every single corner there is in the room. But for a quick turnover, it's more like you have to be literally quick. So you have to make sure you get everything done. You might not have the opportunity to move every part of equipment there is out there in the room. But you try to get the edges, you try to get the best you can. And after mopping, you are all done. So that's what a quick turnover consists of in an operating room. And I look forward to looking at all your videos. Thank you so much.